Hi, I'm Dr. Nicole Bain, and these are the important post-operative instructions that I would like for our patients to follow following surgery. You're going to be given quite a few things on your day of surgery to take home. An ice pack, which is something that a lot of times people don't often need, but it's one that you can alternate on and off the site if you feel that you're going to have swelling or if your jaw is sore. And they're refreezable, so you can keep rotating that on and off at 20-minute intervals or 1-hour intervals, depending on how much you can tolerate the cold. The most important thing is no drinking through a straw for more than 48 hours. That also includes smoking. Anything with a negative pressure that can suck or lift the clot off of the site, you're going to want to avoid. So no straws, no suctioning, no vigorous swishing or spitting. Expectorating really forcefully can also pull the socket or the clot from the walls of the socket. The other thing is we don't want you doing any vigorous exercise for 48 to 72 hours. Inflammation peaks at 48 to 72 hour range. So as long as we get you through that critical window, your body's natural healing will start to take place. Vigorous exercise that gets your blood pumping way too much can cause excessive bleeding or it can cause things to be dislodged. So just take it easy. A mellow walk down the street, yoga inversions are not a good idea, even though mellow, because we don't want your blood going up towards your mouth. We want to keep your head above your heart as much as possible. The other thing to remember is you're going to be given some medications. Now, most of our extractions heal without needing anything more than an Advil. I do recommend if you are having some intense discomfort to alternate 800 milligrams of ibuprofen with 500 milligrams of Tylenol. You can alternate those at 2 to 4 hour intervals so that you're taking the ibuprofen every 4 hours and the Tylenol every 2 to 4 hours after. You shouldn't need more than that for the first 2 days. If you do, I really want you to give me a call and make sure that everything's healing well. Now, I personally don't like taking medication. For all the surgeries I've ever had, the most I'll need is ibuprofen for a day or two. I really like some of the remedies we're going to give you, which is T-Pain or Trameal. This is a mixture of Trameal, Arnica, Calendula, Chamomile, Hypericum. All of these natural homeopathics are really, really great for reducing pain and inflammation. And I can tell you from experience with my own surgeries, one of them, I was incredibly swollen and bruised after my gum surgery, and what I thought would have taken a week to heal was gone in 3 days. It's pretty incredible. These you can't overdose on. You can take them very frequently. So I do like having this because if you feel you need a little extra, you can keep taking it, and it's still safe, doesn't mix with other medications, there's no harm to your liver. So I do prefer the natural remedies. We also will give you a natural remedy of Stella Life Gel, which is essentially a homeopathic neosporin. It's going to reduce pain, inflammation, bacteria. It's really, really helpful. And again, that's another thing that you can apply frequently to the site. You can apply it as many times as you want. Another thing that we'll give you are our healing hostesses. And they're a little vial that's bentonite clay mixed with a lot of other homeopathics and a lot of essential oils. I call it Jesus paste because it has frankincense and myrrh in it, as well as a lot of other essential oils that are antibacterial. They really aid in healing, and they just protect the wound site from having any injuries from food or other items. And you'll just take a little dab of it, and you can pack it into the site, and it'll actually stay there. It doesn't taste bad at all either. So that's another thing that we recommend. We'll be giving you a vial of ozone water and a syringe that you can use to gently irrigate the area. We don't want you introducing the tip of the syringe into the socket site at all. We just want you to gently debride the area. What you'll do is you'll fill up the syringe with the ozone water, and you can slowly rinse around the area as it's healing. It'll keep any debris or anything from getting packed down in there. But what may seem logical to shove that down in there, we just don't want you disturbing the site. Once the ozone water is used up, and it's only good for 24 hours anyway, then you can use a saltwater rinse, or you can use Stellar Life rinse, which is one of the natural homeopathic rinses, or you could use dilute food grade hydrogen peroxide with distilled water to rinse the site. We don't expect really any complications. We rarely, if ever, have had any. But should you have any discomfort, swelling, pain, tenderness, give us a call right away. We will get you in. Some of the things we can do for you are, I have laser that can stimulate healing and pain reversal. It's called photobiomodulation, and any of our team can do it, and it really will reduce the inflammatory cycle almost instantly. The other thing we can do is re-inject ozone or procaine or do prolotherapy on the site. And with really complicated infections or long-standing pain cycles, it really helps break the pain cycle. So if someone isn't responding well to the other natural immunity factors or the other NSAIDs or pain relief that you're getting, that's a really helpful technique that I use for reducing pain and inflammation. But again, feel free to give the office a call should you have any concerns. Thank you for watching this video.